Welcome to the latest episode of CarePoints. I'm your host, Kenny Schiff, the Chief Marketing Officer for Lone Star Communications. Today's episode is part of my continuing series of conversations with my collaborators at Lone Star, customers, partners, and notable folks in the tech industry. And it's my pleasure to interview Steve Tyler. Welcome, Steve.
Hi, Kenny. Good to see you.
Let me tell you a little bit about Steve, and then I'll have him tell us about himself. Steve is a seasoned product and technology executive with over 20 years of experience in healthcare, especially in the software as a services solutions realm. He has a strong record of driving growth, managed regulatory compliance, and leading mergers and acquisitions. Steve has held significant roles such as Vice President of Clinical Collaboration and Alarm Management Products at Tiger Connect, where he achieved substantial growth, Chief Technology Officer at Vocera Communication and Extension Healthcare, now owned by Stryker, and where in all of these cases, he shaped the clinical communication and collaboration market. Currently, Steve provides strategic consulting for organizations looking to develop and refine their software product strategies, particularly in the healthcare sector. Thanks for joining me today. You know, Steve, our little corner of healthcare technology business has lots of interconnectedness. No pun intended. And together we have lots of friends and technology experiences in common. My friend Tim Gee used to refer to himself as a connectologist, and I think you fit into the category of connectologist. So today we're going to talk a whole bunch about making products for the healthcare business, but I want to explore a little bit about your background. So let's talk about Extension Healthcare and what led you to Extension Healthcare, Vocera, and eventually Tiger. Let's just start there. Why don't you tell us a little bit about that?
Thanks, Kenny. I do think I've spent quite a fair bit of time connecting things. That does seem to be a theme. I started in deploying EHR and EMR solutions and integrating them, connecting practices and hospitals and feeds of data and getting the right information to the right folks. And it was readily apparent to me in that exercise that there was an opportunity to develop some software to help get that digitized chart information to more places so that caregivers could be more effective. And that ultimately led to the founding of Extension Healthcare. And we started with integrating with an EHR and putting that information on a phone. That soon led to medical device integration, telemetry, and so on. And ultimately, where we ended up was to my knowledge, pioneering the concept of contextual or situational awareness-based communication. Essentially, this idea that we can combine data that we have with data that just changed and presenting it on the phone so that the caregiver has the context. And I continued that exercise as Extension Healthcare was acquired by Vocera. Later, Vocera was acquired by Stryker. And I'm proud of the fact that that software is still out there being used in lots of places and is helping caregivers understand what's going on so they can more effectively respond. Later, as you mentioned, I spent time doing similar things at Tiger Connect and helping them evolve their messaging platform. I'm very passionate about developing products and making sure that what gets put in the hands of caregivers is going to be helpful. That's easier said than done in my experience.
And as I recall, going back to the early days of Extension, this part of the special sauce was the whole Cisco thing, which 10, 12 years ago was very, very, especially very important, still important, but really important then. You want to talk a little bit about any ahas that you had about what Cisco brought to the healthcare enterprise and the things that you could add on top of that?
Yeah, I mean, from a business strategy standpoint, it was very effective for us. We're a young startup. We have lots of great ideas and we're proud of our developments and our innovation. But when your software isn't used by many, credibility is challenging. And so being able to work with Cisco and essentially tell Cisco, look, you've got the most effective infrastructure for voice communication. It's everywhere and it's consistently used. We can make that much more effective for caregivers. And so it was a great relationship in that they provided the infrastructure and we provided the data, and we went to market together. It walked us into a lot of doors, and that's a big element of the growth that Extension Healthcare experienced. It was very effective.
And you were in many respects, at the right place at the right time, because in the earlier part of the 2000s, the connectology that we're talking about largely centered around, say, emergent healthcare, which was around the same time that you were starting up, was acquired by Philips. So Extension was in a position to be more of a real extension than Philips was with the emergent product, whereby they were really kind of centering it on the Philips universe. And so two things happened there. One is there was a bit of a vacuum because of the opportunity left by Philips' acquisition of Emergent. And then 2009 in the United States, because of the HITECH Act and the money available for EHR readiness and rollouts, all of a sudden there was a need to somehow mush these things together, and Extension was there. So as you imagined what that was going to be like 15 years ago and where we sit today, and now that you have worked for some of the most important players in that, what's the scorecard? How are we doing? Did it turn out to be the way you expected it to?
I love that question. It's a little bit controversial. It's a good question. My summary point here is, I think we've helped in many ways. I know directly of circumstances where impassioned caregivers and nursing leaders, physicians have made it very clear that the existence of our solution, when well integrated with other systems in the healthcare enterprise, has saved lives. And I'm grateful to know that. But I think in transparency, I think we've disrupted a lot too. The nature of delivering, in the case of Extension, my work at both Sarah and Tiger, we're delivering notifications for relevant events. And I think there are situations where the existence of asynchronous communication and notifications is disruptive in that it's contributing to the noise. So I think it's a double-edged sword. I think we have a lot more work to do. We've helped in some ways, but we have more innovation is required.
So our friend Myron Wallace likes to talk about customer delight. So we're sensing that the customers have a need, we're fulfilling that need, but maybe we're not delighting them, and we're not delighting them because we haven't figured it all out yet, right? So you have some sense of what are some of the missing pieces that can get us to a better place?
I think we need to begin with the idea that just because somebody says they need a feature, it doesn't mean that we should develop the feature. It's so easy for us to focus on solutions and not have a good understanding of the problem. And I think the missing piece in this little corner of the world is we don't have enough of the right data. We have lots of abilities to do things, but in speaking to a lot of healthcare leaders, the big challenge is knowing what's actually going to help. And the only way to do that is to prove it. And to prove it, you need data. So I think that's the biggest investment is around data. With that, I think we have to be able to translate how these solutions are having an impact on the outcomes that customers want to accomplish. When the starting point is, we need this solution because something happened that resulted in somebody getting hurt, and we identified the gap, or the way this facility has been built, we want to create a quiet environment for patients, and therefore there has to be another way to ensure the caregivers hear the events as they occur. we have to get deeper into the ways we're going to create the best environment for those patients. And that's what I'm referring to, where I'm saying disruptive in some ways. We didn't have the right data to be able to ensure we enabled the right workflows.
And technologists tend to focus on building things, and maybe there's a gap between the building of things, the observations necessary, and the data necessary to really completely address the customer needs. So you have written a pretty elaborate blog post that appears on your blog, and I'll have you give the URL a little later, and we can put that in the show notes. And you talk quite a bit about this concept of balancing needs and wants. So let's go there. Can you elaborate on how product teams can effectively balance these two aspects during development? So the needs versus wants.
Yes. So there's a very clear tendency when a customer says, I need a feature that does X, I need a thing that does, the tendency is to, well, they're a big customer, they're paying us a lot of money, our job is to make sure they're happy, so we're going to build that feature. And the reality is our job as product managers, in this case, is to recognize that that's a symptom and not a root cause. I refer to it as the features loop. And the development of more features results in a demand for more features and more pressure to develop more features because we showed up and said, here, we've got a long list of features. Nowhere in that is the experience. Nowhere in that is an understanding of the problem that this solution is intended to solve. And so what happens is, customers might develop their perception of what problem they're solving, but we may not know that. So that misalignment of expectations results in us building what customers say they want versus what they need. And instead being able to ensure what's developed is translated into an outcome, reducing length of stay, focusing on throughput for patients or what have you, and making sure that the behavior that is created can be connected to that. And presenting that and having that conversation with the customer instead of just taking the feature request at face value enables us to focus on what they need rather than what they want. And quite often that's actually something different.
You want to give us some concrete examples of that from your background at either Extension or Vocera or Tiger?
Absolutely. There was one example. One of our customers contacted us and said, we are completely overwhelmed. Your system is sending so many notifications and it's just terrible. You need to come down here and you need to sit with us and you need to explain to us why it isn't working. And so we visited and we sat down in the conference room and we got to know one another. And the leader in this case was conveying how proud they are of how they reduced the falls risk significantly, and rightly so. Patients that are at risk of falling and hurting themselves, if they're reducing that occurrence, then they're reducing the people getting hurt, and that's admirable, and that's why we should all be working together. But as we got into the conversation about what was occurring, we quickly understood that anytime any patient was getting out of the bed, everybody on the unit at the same time was all being told about this event. And it was all occurring for every patient, regardless of whether there was a full risk or not. And so this is this example of what I need is, and I've seen this several times, I have a fear that I might miss something if you don't tell me everything that is occurring. It's a fear-based reaction, as opposed to using a scientific process to use situational awareness to understand whether that's actually going to be helpful or not. The solution in this case is to use additional data, then once aggregated, enables the solution to know whether it's relevant or not in a safe ways, to reduce the noise so that when the phone does beep, the phone is going to show me something that I need to know because somebody needs help. An example of a fear-based reaction resulting in, I want this to happen, when the need is actually something different.
So I think the process you're describing lines up with what you had talked about in your blog about identifying true needs. So here somebody said something, but it turns out that there was more to it than what they just said. So talk a little bit from a technique standpoint, from a product development, product management standpoint of, in this case, observation, conversations with the customer, but there's more to it. I sense that you have a sense of how you might advise, or in a new product management situation, you would tackle something like that.
Yeah, I think there is more to it. I think we're all used to the idea that the product manager is the person that understands the user. I prefer people that are using the product, so we can humanize the people that we are serving. That they understand the person and they know what's needed. I'm going to draw you a picture. The reality is, I think the product manager is the one that is accountable for harmonizing all of the stakeholders from a customer standpoint during early discovery, and from a business standpoint, so that everybody has the same set of facts. What problem are we solving? What facts have we gathered to establish that we have a good understanding of that problem? And from there, knowing all the stakeholders across the business are all on the same page about knowing what that problem is, then we can observe what is occurring currently, combine that with the data that we've gathered structurally, and develop what the solution is. And the number of times where I've seen, even in established products, used broadly in market, where that wasn't clear, was surprising to me. So clear facts combined with observations gets us to a point where we have alignment across the business on what problem we're solving and what our solution is. From there, using a scientific process to score and prioritize which elements of that problem we're solving first, and ensuring, as we mentioned, that we can interpret the impact of our solution with the objectives that our customers have. We have to line all of that up. It's much more than knowing what feature is needed.
Yeah, and inherently you have an internal partnership with your various counterparts within the development side of things, but also with a pretty broad group of people on the customer side who represent what their needs truly are. So one of the things that's happened over the last 25 years is we've all become brilliant about what products should do, and all the features that we want. And various marketers and manufacturers have given us every imaginable feature, many of which we don't really want or need. So how do we avoid feature overload? And how can product managers do a better job of sort of paying attention to what's really important versus what's cool, or just something that they know that they can work in that's, that's unique or different? So how do we avoid feature overload?
Yeah, it's challenging. And I certainly can attest myself to contributing to feature overload by impassionately espousing the virtues of one idea or another. I am guilty of that. Assuming we have a clear understanding of what problem we're solving, that's the first step. Making sure that we have alignment across the business on that is the next step, as mentioned. Understanding that there's a cost to every feature developed, I think, is one of those things that isn't as well understood. It's easy to consider, well, we developed that feature and now it works and we're good, right? move on to the next feature. There's no cost, but there is a cost. If you're thinking about a manufacturing process as an analogy, every feature involves inventory of parts that sit on the shelf that requires work to build the product and ship it. And so the cost of these features starts slowing velocity. The next release takes that much longer. Reliability is impacted. I use jokingly the analogy of the water cooler, right? That used to be that you had to turn that big plastic container upside down, and there's only one person in the office, Jim, that was feeling comfortable with doing that without throwing water everywhere. But when I walked up to that water cooler with a bunch of paperwork under my arm or my laptop or something, and I had my mug in my hand, I could pull the lever with one hand, water would rush out, it was cold, I got my water. Well, now we don't have those big containers. We have a pipe of water going in, and that makes sense, but there's a whole host of buttons and complicated controls to figure out what temperature of water that I need, and I can no longer pull the lever with my thumb, and the water comes out slowly, but we added a light. And so the key observation for me is we have to learn how to say no. The light in the analogy of the water cooler is not helpful, no matter how clever the positioning might be in making the water healthier or whatever the justification is. It's not about the value that I want to get out of getting water quickly that's cold into my mug. And so saying no to me is the biggest deal, and that we can do that provided we've established alignment across the business so everybody knows why the answer is no. I think that's the key.
So you've spent a lot of time in healthcare and a significant amount of time specifically in the software as a service part of it. And healthcare is special, unique. There's a lot of money, effort going on in it, but it doesn't represent tens of millions of end users in the way that consumer products are. So talk about how all this plays out specifically in healthcare. And in the blog, you talk about, again, this need versus want dynamic, and it's unique in healthcare.
It is. It is. The amount of education, the amount of effort, the downright traumatic experience that caregivers often deal with in providing care in some of these environments is beyond what I could ever possibly understand. And whereas in many other industries, you've got a reasonable understanding of the experience of playing music with a music playing app, for example, most of us, unless we've been a caregiver, have no idea. And I think that the starting point about unique challenges in healthcare is you're never going to understand what the caregivers are going through. From a patient safety perspective, from a regulatory perspective, the complexity of workflows, often those workflows are impacted by the fact that that's been the workflow for decades. And we're adapting that workflow from a paper records perspective to an electronic record perspective, and then adding in additional, sometimes loosely connected technologies creates a challenging environment for the caregivers because they're jumping around between all sorts of different things. And so for me, the challenges that the caregivers face is so much more paramount for product and engineering resources and vendors that are wanting to deliver a technology because it's so different and it's so critical. And so we have to have a system level understanding, not just of our own product, but of the environment our product goes into. When you combine that in a hospital setting with medical staff, employed staff, IT and biomed, often multiple disparate legal entities with their own set of perspectives. There's a lot of work that we need to go through to make sure we understand the problem that we are helping.
Well, my experience as a founder alongside of yours, we know that you could have the best idea, potentially a really impactful idea and platform set of technologies, but delivering it, because of all the things that you talked about, is a lot more. So it makes it tough for somebody to be working in a garage on a platform, knowing the complexities of actually deploying it and delivering it and sustaining it. There's a lot more there, which leads me to the next point that we were going to talk about, which is regulatory considerations. You began to touch on that. So how do regulatory requirements influence decisions about prioritizing user needs over wants in healthcare product development?
Yeah, what we all want to do is spend our time developing those capabilities that delight the people that we serve. Absolutely. But when there are regulatory constraints that make it clear you don't have a choice, you will do these things. You will prove that everything you've developed does exactly what you said it was going to do, and you will prove that it's safe. That's very different than the commonplace agile software development methodology. It's the adage "move fast and break things" is incongruent with prove before you ship that product that it does everything you said it was going to do and that it's safe. And so it has a huge impact on the way we develop software and the way we deliver it. It has implications across many departments outside of the development of the software. And so the impact of that means that we have to be a lot more thoughtful with regard to not just the discretionary investments that we make. We think people would really like it if we did this. We have to balance that with a non-discretionary. It must do this. We must have complete traceability. We must have a robust audit trail of everything that occurred and so on. There are essentially more influencers and more requirements that have to be addressed, and it makes it much more complicated.
Yeah, and I would think that we're at an interesting time in that the talk of less regulation, deregulation may play into all this. Do you have any thoughts about what's unraveling in today's environment?
Certainly that's possible. From my philosophy, when I first approached developing software as a medical device, my attitude was, we're not doing this because the FDA says so. We're doing this because this happens to be based on a set of international standards designed to produce more reliable software. So for me, if regulatory standards are relaxed, okay, fair enough, but I don't think it has much of a bearing on the responsibility of developing software that's going to be used in a clinical setting that must do the right thing, otherwise people get hurt. It may be that the legalities of who's responsible looks different, but from my perspective, nothing's changed. We have a responsibility to build software the right way, and the guidance that the FDA provides is challenging. It's involved. There's a tremendous amount of things to learn, and it's pretty far off the agile methodology track. But when you figure out how to adapt that to your software development life cycles, I've found it to produce better software. And so I'm not concerned about it from a delivering a product perspective.
So, Steve, I think a lot of your experience and success has been because of your advocacy of user-centered design, especially in healthcare. And I think it's in recognition of all the people that these applications and platforms have to touch, which may not be so obvious from the if you're just purely starting from a problem standpoint. So let's talk about user-centered design. And can you share some examples where user-centered design helped distinguish between a user's wants and what their actual needs were in a healthcare setting?
Yeah, absolutely. So to be clear, user-centered design, what I'm referring to here is instead of, here's our app, tell us it's great, yes, it's all done, just go use it now. It's involving the user in the process all the way through. It's beginning with a conversation with the user, like we've talked about, what problem we're solving. It's providing multiple approaches to solve that problem from an experience perspective, and shutting up and listening to them talk about what they're looking at. And then it's developing something and showing them early versions of it during development to make sure we've got it right, and then putting it in their hands and asking them to use it, and so on. So that's the gist of the process I'm referring to. And the big example is, what I see in messaging apps, right? There are many messaging apps. And sure, I could use any one of them for healthcare, but that's not the same as a healthcare application designed for clinicians to use. We may be used to clicking a button to start a new messaging conversation and typing somebody's name, or pushing the phone button and picking which phone number and dialing. But when I'm a caregiver and I know I need to consult with an expert, a specialist, and I'm under duress and the patient's being impacted, this is a whole different world. We have to take a much more thoughtful approach. And so in one example, then, the number of steps that I take in some of these applications to get to the point where I can make that call. Well, first I have to either identify the person, so maybe I'm going somewhere else to figure out who's responsible. Maybe I'm able in the application to identify that person by role. I don't actually care who they are. I care what role they have, because they're of the right responsibility for my patient. But even then, I've got to click 4, 5, 6, 7 buttons to get to the point where I'm speaking to them. And when the phone call begins, I still have to convey all of the things that already occurred to get the other person up to speed. And I should also need to make sure I properly identify the patient. So quite a bit of time has gone by before we're actually talking about the problem and coming up with a solution. Whereas in one particular example, being able to begin the process with, are you making a phone call or sending a message? Being able to represent in the context of the patient, in the context of the event that just occurred, who might be responsible, and then clicking a button to contact that person and have the context automatically be shared. So I don't have to convey it because I see it on the screen when the phone rings. That's a completely different world. And that's a direct example of user-centered design from my experience.
Yeah, it's interesting. Our company is a Microsoft Teams centric environment. And in as much as I have a great appreciation for what Microsoft has done, it would be really not well suited for what you're describing, for all the reasons you're describing. It has a lot of information, but from an orchestration standpoint, it has too much information, and there are too many choices that the user has to make on the fly to sew these things together in an effective way. And while I'm rooting for them because I think they have a great opportunity, it's a bit of an erector set, whereby a purpose-built clinical collaboration application that is closely tied to EMR could provide the situational awareness and actually provide a hybrid set of information and communication tools all in one place. And garden variety consumer applications aren't built for that.
Right. Yeah, I describe it as me working for the software as opposed to the software working for me.
So I suspect that while you may have interest in development and coding, that That's not what you're looking to do today. So what's happened for you over the course of your career is you've become a leader, and it's about guiding product teams using your experience and your knowledge and all the things that made you who you are into a leader. So as a leader, how do you mentor your teams to focus on delivering the value by addressing true needs? So you have to bring all your experience to the table, and now you have to work with other people to get that done.
Yeah. For me, it begins with empowerment. The people that are tasked with figuring out what a product should do, developing it and bringing it to market, the businesses where they do this have to empower them to be able to lead with the insights they uncover. And that seems like a really obvious statement, but from my experience, that's not always the case. They have to be bold to be able to ask why and be prepared for the answer to not be what you thought it was. I talked earlier about, the importance of alignment across all the stakeholders. Everybody is responsible here. If a product team is going to be successful, it's successful because they established alignment across the business. What that means is everybody from sales to marketing to customer success to support, as well as product and engineering, finance, everybody has to contribute data so that there's a clear picture about what's actually going on. And most importantly, the business has to be in a position to listen to the answers. And so my message to teams that I've led has been, be empowered. Know that your voice matters. Believe that it's possible that a solution can be developed that is going to make a difference. You have to know that you're working on something that means something. And we have to do so in such a way that we're working together to make that happen.
So do you think that manufacturers, developers can be too focused on market trends and competitor features rather than some of the things that you're talking about?
I very much see that. The various ways I interact with my smartphone via my watch or some headset or something else has created circumstances in the past where, well, that's clearly what's going to happen in healthcare. We didn't stop and ask whether that was actually going to be helpful. And so there have been many fads that become commonplace in other industries but doesn't work in healthcare. So yes, I think it's really important that we stop, consider the needs of the caregivers, consider the needs of the patients. Are we actually doing the right thing? It's very important.
Yeah, and there are practical realities. So we know that over the last 5 or 6 years, what we used to think of as, say, machine learning and big data and all that has morphed into the kind of AI gold rush, if you will. So everybody is trying to have an AI spin on what they do, and it's probably a good example of what you're talking about. So how do you measure success? In the end, if you are a good product company, obviously revenue matters, but there are other elements of the success equation. So why don't you tell us about how we measure success and how we use that to effectively steer what we're doing from a product standpoint?
I think it's a challenging topic. Obviously, we should be tracking, customer retention and support ticket trends and, all the obvious elements that say you have a product that works, you have a product that's being used, and it's reliable. But I think that in order for us to actually be successful, we need to recognize that usage itself only gets us so far. Are people engaged? How do we know people are engaged? Well, we know that we're having an impact. The impact is how we've aligned the solution that we know solves a problem with the business. And so maybe we should be looking at things like length of stay or left without being seen rather than the number of phone calls that are made. The product-specific metrics driven by the problem that we're solving needs to be aligned to the problem, right? Sure, it's helpful for me to know the number of phone calls, the number of messages sent. But if the problem we're solving is caregivers are overwhelmed, and as a result, there is a risk of omission or commission that results in a communication breakdown that results in a patient getting hurt, well, then maybe we should be measuring the number of occurrences where we were able to safely suppress communication to reduce the noise level. And that may or may not be appropriate based on the technology, but I'm using that as an example for product-specific metrics that tell us much more about the impact we're having. And then rolling all of that up into the ability to get care to patients, to get patients moved through the system, is how we're able to demonstrate that we're actually making a difference. I think the sensitive element that I've seen is there's a tremendous amount of pride, perhaps rightly, in features that develop, products that are developed, and seeing the big impressive numbers on it being used perhaps is a bit more about pride than it is about knowing that we're making a difference. So to me, it's evidence ultimately of how the product is actually solving the problem we set out to solve.
So let's give you an opportunity to talk to the business folks who are creating products and platforms. And what are your recommendations for those people regarding the pathways, kind of summarize the pathways to successful product?
I would summarize it in two categories that I think everything stems from. And maybe this is somewhat ideological, but I think the question itself is ideological. How do you create the product that's really going to make a difference? I think so. Those two categories are integrity and alignment. Integrity is customers know when you're showing up to talk about something that may or may not solve the problem they're looking to solve. Know what you do and what you don't do. It's far easier to say yes than it is to say no. You have to perfect the art of saying no, and that's what integrity is about. And that can sometimes be at odds with the need to close enough deals to generate enough revenue to keep the ball rolling the way you need it to. That's a hard thing to look at times. I know it has been for me.
Sure. Yeah, the showing up piece and being authentic and transparent and being clear with the customer about what you can and can't do. I had a recent conversation with Steve Keen, who was one of the co-founders of Akivera, and he essentially said the same thing that you did, which is when you are working on important things where life and death matter, you can't give people things that you think they want. And you need to be clear about what you can and can't do because a lot depends on it. And being honest can work well, actually, from a business standpoint. It can actually be a reasonable business strategy.
Absolutely. Absolutely. And then, the other category for me that I've touched on several times is alignment. There's a tendency in my experience that product and engineering or engineering separate from product are just in their own worlds. Cases where products have been developed and presented to a set of go-to-market teams that have never seen it before and don't know what it is and don't even agree with the existence of that product. That's never going to have the right sort of impact that was intended for the people that it was developed for. It's never going to happen. We have to have alignment across the business. And I find myself pressing on that more and more because of how much of an impact that has. From the exec team on down, everybody has to know why we're building something, what problem it has to solve, and how we're going to solve it, and where we are in the process. Everybody needs to care about it, not just those that are writing the code.
So let's think ahead a little bit. So what do you see as some opportunities for people who are making products for the hospital market in the US in 2025 and beyond?
Well, it's very clear that AI is going to play a role. My personal perspective is that role is perhaps less related to direct caregiving processes, is a supportive role. That's probably a safer way to perfect technology that is moving at a very rapid rate. I believe that from what I've seen, what we actually need to do next is get a much better handle on the data. We have pockets of data. We have some data that's more structured than others. If we're going to address big problems like a shortage of 500,000 nurses, we're going to need to do more with less. That's clearly what AI is going to help us with. But the prospect of trying to do direct caregiving related, trying to accomplish caregiving related processes using AI with a shortage of nurses is pretty scary to me. And so I think it's about getting a handle on what's going on, continuing the journey of digitizing the elements of care giving processes that aren't in the chart, and making decisions on how to automate the caregiving processes that can be automated. And that's how we're going to address some of those big picture problems, in my opinion.
Cool. So if somebody wants to get in touch with Steve Tyler, how can they get in touch with you?
I have a website, stevejtyler.com. By all means, please contact me there. You can find me on LinkedIn as well. And, I'm passionate about building great products that make a difference. I will give you my opinion. And if I don't have an opinion or I don't have expertise in some area, I will tell you no, because integrity is important to me. I'm comfortable with saying I don't know. I think that's a solid starting point.
Yeah, I think that's a great thing about the work that you have done and shown in the successful products that you've worked on. And I think it's been my pleasure to chat with you about all these things, and philosophical and otherwise. So thanks for joining me today. Thanks for you who are all listening to CarePoints. And if you're listening on Apple or Spotify or watching on YouTube, make sure to hit the like button and subscribe so you can get notified when we release new episodes. And you can visit us to look at past episodes at www.lonestarcom.com/podcast. That's www.lonestarcom.com/podcast. Thanks so much for listening. It's great to be with all of you.